ahead and introduce today's speaker, Tanya Cutting, who is from Community Health Centers of the Black Hills, and she is going to share some insights into how she works with patients to find affordable diabetes supplies, medications, resources, etc., and also share a little bit about Community Health Centers of the Black Hills. So I will go ahead and mute everyone else until we are ready for discussion, and I will turn it over to Tanya.
Thanks, Ben. Yeah, so my name is Tanya Cutting. I'm a dietitian, diabetes educator. I work at a community health center here in Rapid City. So a lot of our patients don't have insurance, and there's some slides that talk about that. Ben's giving you an overview of what some of our folks look like. We were established in 1992. I've been working here since 2010, so for the past 8 years. And during that time, we've become a state-recognized program, and now we're a nationally recognized program. And one of the things that's unique about my services here at Community Health is that we provide my services for free, so we don't charge. We have grants that cover the cost of those services. And what we found was initially Medicaid was not reimbursing for MNT, and we didn't have a recognized program, so we couldn't charge for DSME, and that's why we chose not to charge. We are now a recognized program, so we could charge for the DSME portion of it. Medicaid does now reimburse for MNT coverage. So those are two great things that have happened in our state, but Community Health has remained committed to making sure that patients have access to nutrition education. So you can switch the slide there, Ben. So we have guidelines. So for patients who are at or below 200% of the poverty guideline, if they do come in and see a doctor, our lowest tier, we have tiers. So there's an A, B, C, D, E, F. They can come in for a visit, get all their labs, their shots, et cetera, for $15 at the lowest tier. And then it goes up to 30, 45, 60. So approximately 82% of our patients are uninsured or participate at Medicaid, Medicare. 50% of those patients are uninsured, roughly. So the other 32 have the Medicare or the Medicaid, and then 39% of our patients are children. Next slide. Okay, so when it comes to strips, this is the biggest issue because we want our patients to be able to get strips and test their blood sugars. None of the meter companies, as far as I know, provide any strips for free these days. So what we started doing here is we also have a pharmacy associated with Community Health, so we have our own on-site pharmacy. And in addition to that, we also have a dental clinic, and we see the pediatric patients as well. But so through our pharmacy, we provide an Embrace meter. So it's $25 for the kit, which also includes, so it's the meter, it's one vial of strips, a Lancet device, and then the Lancet, so that's $25. Walmart Relion meter is priced similarly. There you just have to go to Walmart to purchase it. I'm not advocating for Walmart, but it is one of the cheaper meters on the market, and the other thing that's nice about it is you can get the Relion meter at any of the Walmarts, so if somebody's traveling or whatnot. In my experience, Walmart is cheaper than Target or Walgreens. I haven't been able to find anything cheaper. There is another pharmacy in town, the Medicine Shop. We have it here, and they also have the Embrace meter, and they sell it for a similar price point. I am working on trying to get regional to use this meter as well, but I haven't had a lot of luck with that, so we do try. That way, for all the patients who can't afford meters in the first place, we'd all be giving out the same meter instead of giving out different meters and trying to find strips for those meters. Next slide, please. For other types of education materials like lotions, cookbooks, basically whatever I need, we have a local organization called Cosmopolitan Club. They're not just local, though. I don't know if there's one in Sioux Falls or other parts of the state, but their mission is to help folks with diabetes, and they've been very, very supportive of our services over the years. So I do approach them for monies every year, and they usually are very generous with those monies, and I use that to buy materials for class or education for those patients. Next slide. In addition so the other big thing that patients face is being able to afford their medications. So like I said, we have an on-site pharmacy. We are a 340B pharmacy. So it's a federal government program. And in my mind, the way I sort of think about this is it's kind of like a Sam's Club for medicines. And if you belong, you get Sam's Club pricing basically, or you get 340B pricing. So on our formulary, we are able to offer $5 medications, which include metformin, glipizide, although we don't use that one too much, but also Farxiga, Jardiance, Victoza, Lantus, and Novolog, all for $5. And I'm sorry, it's Levemir and Novolog, but Lantus was just added to that. So, and then in addition to that, because we have so many patients that are uninsured, we have a staff member who is a patient medication navigator. So they will fill out all the paperwork for the patient or help that patient. They have to set up an appointment. They come in, they fill out all the paperwork, and they submit to the pharmaceutical companies so that they can, so that those patients can get their medications for free. Next slide. Some additional tips for affordable medications, the discount cards. Those work as long as you have commercial insurance. If you have like government issued insurance like Medicare, Medicaid, they don't necessarily work. So you can see with my patient population, I've got 82% who don't have any insurance, or they have Medicaid, Medicare. We don't often get to use these, but when I can use them, I do, obviously. We obviously want you to discuss medication costs actually with the provider before you even get to the pharmacist, because once they've written for prescriptions, so we definitely are having that conversation with the patient. Like, you know, is this affordable to you? Is this something you can swing? We have funds from the United Way where we can also voucher medications if need be. We try not to do that in a sustainable manner. If we have patients that are really hard pressed to pay for their meds month after month, even though they may have insurance or something that doesn't cover those specific meds, then we have them go through a hardship application, and that's pretty minimal here. So you can also do GoodRx. I find that a lot of the pharmacies in town, like Target, Boyd's, they will help you find the least expensive priced medicine if you tell them that that's an issue. So you can always approach your pharmacy. And then the programs, so this four-step, some name brand medications include discount cards and medication affordability programs. We have that patient medicist navigator to help patients fill out that paperwork and get it submitted so that they get their meds on an ongoing basis. So we help them with that process because it can be really overwhelming. And I would say if all else fails, consider asking provider to change to generic medications. You can do that, but in my instance, I would say have the patient start coming to community health because we can do a lot at a very affordable price. So next slide. Questions?
Thanks, Tanya. Let me unmute everyone here. Does anybody have any questions for Tanya? So I did think of one question to start off questions here. Are there other 340B, I believe it was 340B pharmacies in South Dakota? And if so, do you know where those are at?
You know, honestly, I don't know on the eastern side of the state. I do believe that Rapid City Regional has some 340B pricing. It's been really beneficial to us, though, I can say that. And, you know, I think it depends on your patient profile, like, you know, who you're serving and how many uninsured versus insured. If I had more insured patients, I'd definitely be looking for those coupons and that sort of thing. So the answer to that is I don't know. I don't know if some of the other educators have experience with that.
Okay, sure. Does anyone else on the webinar today have any insight into 340B pharmacies? I guess it's certainly something that I could pull together and look up as well. I'm wondering if maybe some of the other federally qualified healthcare centers might also have similar pharmacies available. Any other questions specifically for Tanya? Okay, well, I'm going to now move us into our discussion questions for today. Thank you again, Tanya, for presenting. That was very helpful.
Sure.
To give a quick overview there on what you do with your program. And it sounds like you have some resources that are available to you specifically. So that's great to hear that you have those resources and are able to provide that to your patients. So I'm just going to have those on the phone today just chip in here and share some discussion questions. The first question being, what successes have you had in finding affordable supplies for patients? And I will say before opening that to others, much like you said, Tanya, the Diabetes Coalition as a whole certainly doesn't pick Walmart over other pharmacies or other meters, et cetera. But we certainly have found too that in looking for affordable meters, test strips, et cetera, the Walmart brand really does end up being the cheapest that's readily accessible and available to patients. And it is pretty handy too to have that just available at the Walmarts, and you can go to different Walmarts to pick it up if you're traveling and things like that. But for others on the phone and webinar today, what successes have you had in finding affordable supplies for patients?
I don't know, this is Susan. I don't know if it's really changing the cost, but just thinking on how used for blood glucose monitoring, especially when it's a challenge for the cost and there's other things to be paid for with meds. Really thinking on what are we learning from the blood glucose monitoring? Are we looking at just mornings to adjust the Lantus insulin? Are we looking at how certain foods are being made, or just how the pattern of the 3 months? There's some patients that may do blood sugars 7 times a day for 2 days right before they go to their doctor and just not do blood sugars other times, or they may do it here or there before a meal, certain types of meals to learn. And to me, that really kind of gets to thinking why we're doing something and what are we really getting at, just not to look at patterns. I do know, doing it once a year is not looking at a pattern, but that was just a real different way of looking at things. And I think the second thing is, again, not necessarily an answer, but the part that you're talking about, the insulin. It's amazing when you really talk to people what percentage of people really are underusing their insulin, or they'll run out and be without it for a few days. And when you're trying to figure out why things the way they are, it's kind of hard to see when somebody's only taking a third of their insulin because they're saying they can't afford, so it's more of the eye-opening when you really ask the questions to see how much it's really going on.
Thanks, Susan. Anyone else have any successes that you've had in finding affordable supplies for patients?
Ben, this is just something else I forgot to mention, is that I do go online to like for my patients who have insurance, I will order one-touch meters because those can be really hard to track down. And so I ordered those online. There's a professional site for like one touch. And that's how I get, like, for my commercial pay or my Medicare, Medicaid patients, I can use those.
Okay, and if you order them online, then are they a little bit cheaper then, or?
They're free. So as a,
okay.
a healthcare professional, you can order so many meters, like I go every 6 weeks to 2 months. And so it used to be if you get like the One Touch Mini or the Ultra. I can't get those anymore, but I can get a Vario Flex. Because the hardest thing is actually sometimes getting the meter. So if you get them the meter and they have insurance, then the strips are covered. But if you can't get the meter, then they have to look at going to a medical supply company to get those. And it's just it's or they're paying for it out of pocket, and that can be challenging for patients. So.
Okay. Next question here is, how do you encourage a patient to work with their provider to find those affordable supplies or medication?
It's getting more challenging, more time consuming. But I think a lot of it really starts or can start with them actually bringing the formulary with them to their doctor. A lot of people have a smartphone, not all. But if you have the formulary of the diabetes meds and you're looking at diabetes out of control and you're questioning which insulin to use or what oral or what injectable, it really helps for the practitioner to have that listing if they have it right with them. And there are some apps that the practitioner can kind of use to try to help to see what costs are and what may be covered on a certain in your area.
I think this is Tanya again. I think that's a really good point, because otherwise you're sending the patient back home and asking them to either call the insurance or bring that information back in, and you may not see them for another 3 to 6 months. And so if they have that formulary there, you can take a look at it, and you can Google a lot of that stuff, but you don't always get the right plan, and it can be super frustrating.
Any other thoughts on encouraging a patient to work with their provider? So next question, do you encourage the use of any specific resources, such as a specific discount card or pharmacy program or anything like that to patients?
I think needymeds.com is something I've used frequently, not just for diabetes, but for any med that may have a coupon, which doesn't help with Medicare, Medicaid. But that also has all of the, if you're going to go through indigent care, need help or assist, all the paperwork that's needed to bring to the practitioner to be signed is there. It can be printed out.
And I will say, from the Diabetes Coalition, we do get a fair number of individuals reaching out to us trying to find more affordable medication. And oftentimes it's individuals who have insurance, but they're still struggling to pay for those medications because the costs are so high. And so working with them to understand what medication they're taking, and then to find some of those discount programs online, or even find discount cards specifically for that medication, works really well to decrease the cost. And we've also had them reach out specifically to their insurance provider, and they often have individuals within their insurance company. I can think of 2 of the insurance providers here in South Dakota who have been helpful in identifying places to go online where you can submit a quick application to receive a discount card specifically for that medication. And then in getting that at the pharmacy, it really does take a lot of off of the prescription cost. I'm not exactly sure why that is, but at the same time, I don't think anyone's complaining when it's that easy to do and then they get the discount. So it's kind of a little bit of a scavenger hunt. And so for some individuals that I've worked with through the coalition who reach out to the coalition to find affordable meds, it's just a matter of kind of searching the internet and finding those resources and materials and finding what works. And then also just having them ask their pharmacist too when they go and pick up their medication. Sometimes if it's a medication that they're having a problem affording, they'll just ask the pharmacist and they'll be able to provide some guidance as well. So certainly, I know something that takes a little bit of time, but certainly a resource that the Diabetes Coalition can provide in helping patients to identify some of those resources. Tanya, I'm just going to pick on you a little bit further here, if that's okay. But with your individual in your pharmacy who now, was it a pharmacy, I forget the title that they had, but the pharmacy navigator person,
yeah,
do you know is that something that your clinic kind of created, or was it something that other clinics have been using in the past and you've adopted that position? Or I guess, can you just share a little bit more of how that works and how that individual came to be within the clinic? I guess it's more of just a curiosity question, if anything.
Yeah. So, we have a lot of lower socioeconomic status patients. So, and applying for those funds is really overwhelming if you're trying to figure out the paperwork. I honestly don't know when it came into be, but I imagine it came around pretty quickly and long before I was here. And we had the patient navigator before we had the pharmacy. So, I just think the process, people don't understand their insurance. They don't understand the difference between deductible and copay. And then you throw a whole bunch of paperwork at them and they get really overwhelmed. And so this person helps them sort through all of that stuff. So it is a full-time staff position at our clinic. We've had it for a long time, but just to give you an idea, we get about $1.5 million worth of medication because of that position. So it really, really helps if your organization can support that. And community health, that's kind of, that's our target audience. That's what we're doing. But I think it's invaluable, and it's really hard. I think, like, if I had to do it during my time, and I already do a lot in terms of not just meds and affordability, but also food, et cetera, I'd be spending an hour or 2 hours with each patient, and that's just not really very feasible. So it's a really nice thing that we have. And the great thing is once you get them set up, usually once we have that paperwork, it's actually really easy if they have like different pharmaceutical companies that they're getting medications from, then to fill out the other paperwork. Or like if they're on Levemir, it's really easy to get Novolog, et cetera. So yeah, I mean, I think it's a great thing to have if your organization can support it financially.
Great, thank you. I will say I've looked up a couple of those applications for individuals who have reached out to the coalition, and they are really hefty applications. They're not like a pharmacy discount card where you answer a couple questions and it downloads or prints your card. They're a pretty hefty application. So I think that's really helpful that you offer that to patients at your clinic. And I didn't realize how much they were bringing in, not bringing in, but how much the $1.5 million worth of medications that they were able to
it's really
obtain.
helpful, yeah. And that saves us money. We really try to, there's only so many resources. Like we do have the 340B pricing, but we're still paying on the back end for some of that. So, if we can get it through patient meds, that saves us money or frees up money to help other patients. So you really, if you can do that kind of stuff, it does help. So, and I think that's where it's really important. I think it's easier sometimes in my position to have that conversation about, what's affordable, what can you handle, is this medication too expensive for you? My patients are pretty used to having that conversation, but the general public, I don't think they are. So.
Sure. So I realized that I guess the next question would be, have you changed anything within your program or education provided as a result of medication and or supplies costs?
What do you mean exactly? Like, like a lot of times with the providers, before we even send them to the pharmacy, we have a long discussion about what they can afford and what medications are available to us. Like, do they need 340B pricing? Do we have to send them over to patient meds? Can we get it that way? Because there's a lot more medications available through patient meds if they qualify. So we're just like, we're always used to having that conversation. And I don't think other clinics do that because they assume commercial insurance. But what I'm finding with a lot of the commercial insurances is they are these high deductible plans that are more like major medical, and they don't have really good pharmacy coverage for medications. And so until they reach that deductible, they're kind of, they're at a loss unless they can get a discount card or something, or there's specific medications that are on their plans that are covered. So does that answer that question for you?
Yeah, so I guess your advice to other clinics would be to just have that conversation with patients when they're in the doctor's office or in the provider's office versus
and I don't want to miss
trying to do it over the phone. And
I just don't know. I don't have a sense of, other clinics may be having that conversation. I don't know, other educators. I really don't know.
Sure, but if they're not, it's certainly something to look into so that you can save a little bit of time too, because then you don't have to deal with the follow-up later on of calling back and forth or trying to communicate over the phone about pricing and switching out a med or something like that. So last question.
Sorry. I just find that
go ahead.
I just find that patients, when they have to call their insurance company on their own, get really frustrated and usually don't come back with the answers that you need. And I think it was Susan who was saying earlier, unless they bring that formulary along, you're kind of shooting in the dark. You have no idea. So.
And last question for today, what other tips or hints do you have to help patients? Is there anything we didn't cover that anyone can think of, or? I guess one question that I have that I've heard before when having a health fair booth for the Diabetes Coalition is that there's now subscription services for meters and test strips, and some of them even are a flat rate of like $39 a month for unlimited test strips. Has anybody worked with patients who use those? And if so, what are your thoughts on those? And maybe no one has come across those yet, but it just seems to be some type of a subscription service for the meter. You buy the meter and then the test strips you can subscribe to get so many per month, kind of like a lot of the other subscription services that are popping up here and there. But I just didn't know if anyone was running into trouble with those, or if they were seeing that as a financial help for a patient who might be needing to test a lot and was spending a lot on test strips, or how that was working out. But if no one has used those before, then that would make sense to not have any insight into those, but just more of a curiosity factor on my end of how those work and if they're a good investment or a bad investment. Or okay, well, that was all I had for today's webinar. Thanks everyone who was able to join today, and I will go ahead and get this posted on the Coalition website so that other individuals can watch it after the fact and catch up with what was presented today. But thanks everyone for jumping on today.
Thanks, Ben.
Thank you.